Good afternoon. This is Commander Steven Parks, the Department Head of Education and Training and Simulation here at Naval Hospital Camp Pendleton.
Good afternoon, folks. Hi, this is Roger Lankheet. I'm the Simulation Center Specialist here at the hospital. I work along with my colleague, Mr. Parks. We're going to take you on a quick journey of our facility, and I hope you enjoy it.
The initiation point for today will be our opportunity to discuss Naval Hospital Camp Pendleton's Simulation Center. As well as the learning opportunity, we will also discuss our application of medical simulation within the Naval Hospital and within military medicine. This is also an additional opportunity for us to communicate who we are. Now, Navy and military medicine are more than just treating the war wounded, as many of you already know. While that may be very important, most of what we do here at the military treatment facilities is centered around delivering quality health care and the patient experience. This is our rationale as to who, why, and how we train staff using medical simulation. Additionally, our simulated learning events can easily translate to the deployed warfighter as well as those in civilian healthcare practice.
So when we look at our mission really is to train. Our mission is you. What that really comes out to be is we want to engage the adult learner to foster opportunities for the learner's self-discovery. Self-discovery through medical modeling and simulation. When we replicate real-time scenarios, we're doing this to allow for enhanced relevancy for the learner. Practice and learning are a couple of points that are real positive attributes for this process. Testing, however, is only one method in order to achieve this type of learning. Active learning is accomplished via engagement of the adult learner on more than one modality. You really have to look at that. You're going to look at several modalities. One of them being visual, another audio, another tactile, haptic feedback, verbal interaction, and feedback. All of these are going to be used as tools to engage the adult learner. Truly, practice does translate into better outcomes. And how does this fit into patient-centered care? You do so by employing medical simulation, which allows for promotion of patient-centered care. It's going to be done via practice again and reflection on part of the learner.
In terms of the role of the department head essentially is the voice in support of the command's training mission, while also communicating from the team perspective the way ahead in regards to not only education and training but also simulation. Now, what's important here is budget and also resources. My engagement and support to the simulation staff is exactly a key component to their continued success in everything that we do here. Now, as a pillar of strength and also the primary command medical simulation advocate, it is vital that I and we remain flexible with the command simulation training needs, in addition to promoting staff development and growth in order to ensure the most return on investment for all staff. Now, lastly, and in my mind of most significance, is the fact that there needs to be command leadership buy-in in order to promote and maintain and sustain medical simulation within the Naval Hospital here at Camp Pendleton.
It is vital that the nurse educator / simulation center specialist have a strong expert knowledge base of healthcare, medicine, and sufficient experience to allow for a competent development of the flow of the scenario. You're going to have to anticipate potential deviations on the base scenario, which would be modified by your facilitator. This is essential to make a smooth scenario. Now, do not underestimate the power of a positively motivated educator. Positive energy definitely gets translated into the scenario. Likewise, the learner will pick up on that positive energy. Key into that has got to be flexibility. Flexibility does equal transition, your ability to adjust the scenario on the fly, allowing for a seamless scenario. Knowledge and experience with multiple high-fidelity mannequin platforms is a must. When you look at your sim operator or your sim tech, again, having a clinical knowledge is critical. They have to be well versed in medicine and healthcare so they can speak cogently with the target audience. Again, do not underestimate the power of positively motivated sim tech. They can make or break that scenario. Keep that positive energy good, you're going to translate to good scenarios. Again, flexibility is just as well for the sim tech or your sim operator. They need to enhance that as well.
Now, in terms of resources and manpower, it is critical to have knowledgeable facilitators and also subject matter experts running the simulation training scenarios. Hence, the perils of non-subject matter experts can be devastating, as many of you may know already. Facilitators are those clinically driven staff and/or subject matter experts who understand and implement tenets of adult learning by incorporating the aspects of kinesthetic and cognitive and affective domains. But one question that we always ask ourselves is, how do you motivate the learner? Well, first, it is important to have a positive attitude, as Roger's already alluded to, towards that learning event. And that obviously equals positive learning. Learners within our hospital setting are comprised of military and civilian medical staff, such as physicians and nurses and Navy corpsmen, and other ancillary medical staff such as radiology and respiratory and lab. Now, if the leadership group does not recognize the value of those particular learning events, it is the responsibility of our team here in education training and simulation to foster the understanding and the recognition. Positive training, again, equals positive learning outcomes, and this is relevant into getting those better patient outcomes. Again, as I stated in a previous slide, it is extremely important to have that buy-in from command leadership in order to sustain our medical simulation practice here at Naval Hospital Camp Pendleton.
When you look at our resources, there's several different areas that we look at. One of the biggest high-ticket items that we have are our high-fidelity mannequins. In a clinical setting, you're going to employ a standardized bunch of equipment, such as your crash cart, defibrillator, suction apparatus, etc. When you're looking at your space and your locality, sometimes you don't really have a choice what you're given with, so you have to do the best you can. In a hospital setting, we like to employ an in-situ learning environment. Precisely what we do is we'll take our stuff to wherever it is, such as a labor and delivery unit, pediatric clinic, internal medicine clinic, so on and so forth. We can bring the training to the learners, not only by having limited space in a hospital, you can bring it to the learners. When you're looking at your relevant medical equipment, obviously you have to work with what the staff is going to be using on a day-to-day basis. Try to make sure that we have in our simulation center the same equipment that we would use on each one of the units and or our clinics. And when you look at your props, well, certainly that's going to be the linens, the clothing, any type of materials that we would see that our patients would have. Henceforth, even with our high-fidelity mannequins, we'll actually clothe them, use shoes. You know, sometimes you see a patient, the mannequin will be there without shoes. If you have shoes on their feet, again, that identifies that to the learner as a human being and adds realism to the exercise. Another one of your resources truly is, the biggest one is your time. How much time do you really have? You're going to have to put time into what you're going to do for your conceptualizing on developing your scenarios. You're going to work with your subject matter experts to obtain content. This is why it's important to have your educator and your SimTech to have a good background so they can speak the same clinical language as what your subject matter experts are going to be looking at. Most events are going to have direct roots in their actual events. Now, programming will take time. You have to allow for a sufficient amount of time to do your programming. That's going to be at least 1 to 4 hours per scenario, depending on the length of your scenario. Now, most scenarios are about 15 minutes or so, but you still have to factor in it's going to be about 1 to 4 hours that you're looking at. And again, you're going to need your subject matter expert during your programming phase. Then you're going to look at your trial phase. This is where you trial this out and adjust as necessary. Probably, I would say to look at that, program it at least twice, trial it 2 or 3 times after that. That way you're going to identify some weaknesses in the program and adjust it as it goes, because it will not run smooth the first time. Just count on that, and then you can run and program it a couple of additional times. When you pre-brief your event, remind your participants that your simulation area, that whole arena, is a safe environment. When I say safe environment, that means you can actually use something like Vegas rules, right? Whatever happens in that sim lab stays in the sim lab. Staff need to feel secure, not judged. You're assessing the abilities to work on this, not judging them. So assessment is good, judgment is bad. You're also going to inform the staff that simulation environment is the place for them to make errors. I want them to make errors. That's how adults learn. You'll make a mistake, you feel comfortable about it, you'll move on to the next step. Thereby, as adults, will learn through their missteps. Finally, if you're going to videotape this, video is a rather controversial step here. Some places use it, some do not. We have dabbled with using video here at the hospital. If video or film is employed for the purpose of debriefing, it's essential that participants are advised that they're going to be videoed and you need to obtain consent. Oral consent is sufficient. However, it has been gone throughout the industry that it's recommended that if you're going to hang on to that video, probably erase it within 24 hours. If you keep it longer than that, then I would probably consider obtaining a written consent for their image and or the play out of the scenario of the events. When you're looking at your events, you also have to debrief. Post-sim event, if you want to look at that, you need to employ what I call good judgment. Steve and I both are good advocates of this process of good judgment. Good judgment in debriefing provides an environment for learning and, if needed, a different type of change. You're not looking to blame anyone for errors. What you're looking for is facilitating group understanding and what went right and what can be improved. Focus on what went wrong. You're looking at what can be improved. You're going to ask open-ended questions. Encourage your students to verbalize different perspectives. Foster constructive peer feedback by making a comfortable environment. You reinforce specific teaching points and key learning outcomes. And if you're providing a video recording, this is a good opportunity for you to discuss that. You can discuss your key highlights during playback. Review each scenario, clarify all the facts, and include team participants in post-scenario discussion.
Okay, ladies and gentlemen, Commander Parks here again with Roger, and we just want to let you know now that we've covered the goals of our Tech Talk, we want to give you some insight into our simulation center.
Sure.
You can see here a nice panoramic image of the Sim Center. Now, while it may be small by a lot of the MedSen standards, it's very robust, and we have multiple pieces of sim equipment. And we're kind of going to take you on a nice little tour here and give you, again, some insight into the equipment that we use in the Sim Center.
And you look at our Sim Center, we also have not only just high fidelity, but we also offer task trainers. And you can look at the whole list of task trainers that we have here. Our Sim Center is only about 440 square feet. It's basically 2 ICU rooms that are overflow ICU rooms. But this will allow us to do in-situ training as well as in-unit or in-center training. As you can see here, here's one of our task trainers. It's a central line task trainer. We got a chance to use this with our Army colleagues. We use this also with our medical internists here at the hospital. Very useful piece of equipment, but it's only one of our task trainers. This particular IO trainer, we employ this in our pediatric advanced life support program. Allows us to do IOs on infants. We actually give the staff a hands-on what it feels like to penetrate a bone. When you look at some of the other pieces of equipment, we're not only dealing just with mannequins, we do have tactile operating material. When we look at, these are high-fidelity simulators, virtual simulators. This is doing bronchoscopy and or colonoscopy, and we also can do ultrasound with our biomedics. Here we have one of our staff internists actually using their actual bronchoscopy, doing a bronchoscopy using bronchoscope, a glide scope, on one of our mannequins, and it actually enhances his skills. It adds the realism, and that particular mannequin is really kind of tough to intubate. Here's a list of several of our high-fidelity mannequins. Not every hospital has to have each one of these, but we find them very useful. We have a maternal-child mannequin. We have several adult mannequins, infant mannequins, and I'm very proud of the fact that we have female mannequins as well. I think it's important that we represent our entire population. So we go from infant to adult and maternal-child, and we cover as many as we can. This is our Noel. You can see the infant off to the corner there. This is also a picture of our 5-year-old that we're going to use for pediatric. SimMan 3G, I see that's many of our facilities in Navy medicine employ a SimMan 3G or something along those lines. Here are two models that I'm pretty proud of, our HAL 3201 and our Suzy S2000. The Suzy happens to be the one that has lifelike body parts, and so it really encourages the staff to do hands-on training. Our HAL 3201 is very useful for our cardiovascular program that we have here at the hospital. And as you can see right here, we're working with our multiple amputation trauma trainer. This is our Matt trainer. He's actually pretty cool. And some more pictures of our Matt.
So from this slide, you can see all the wonderful resuscitative medicine programs that we support. The big money maker here for our department as well as the command is the Advanced Cardiac Life Support Program. So we've incorporated simulation into all the resuscitative medicine programs. I'm very proud of that. Roger and I have worked tirelessly in getting this moving, and the commanding officer has supported us 100%.
Well, and just a real quick one on that, Commander. Things that we wanted to enhance with our audience here is this was a previously unadopted program. Every hospital does ACLS, PALS, NRP, but they did not incorporate simulation in these programs, not high-fidelity simulation. They did a lot of notional training. And when we came aboard, we said there's a better way to do it. So we've incorporated high-fidelity simulation in all of our resuscitative medicine programs. Mm-hmm. And as you look on the list here, all of these programs, we're incorporating fidelity simulation, whether it go from our clinical skills sustainment, our mock codes, TCCC, NRP, the whole gamut. We hit them as much as we can.
And Roger's right. You know, a very important aspect to this as well is the support to the external force. And when I say external force, I mean the Marine Corps and the Army. So especially with our TCCC, our Tactical Combat Casualty Care Program, we've instituted simulation. We've worked with the Medical Battalion in their simulation center as well in getting that moving. We've given them advice and counsel on how best they can set their sim center up. Another area as well is the Hospital Skills Basic Program for our corpsmen who report to the Naval Hospital.
Right.
One of the ways that we've sustained their skill sets is by adding simulation to this program, and that has been a big success up to this point. And I must say, I need to just state this last point here about the programs. One thing that the CO has been all over at this command is mock codes. And so Roger and the team has done a great job with doing the in situ mock codes throughout the command, and the staff are very supportive and have read it very well.
All right, as you can see here, we've got a good slide of us in action. We're doing some ACLS on this slide. Here we've got medical residents working on our HAL 3201. They had a really good time with that. He's got really good pulses. And we're going to show you a video here shortly.
As well, maybe 300 milligrams?
So go ahead and click on that button on the ACLS practice event. It should open up for a brief 30-second video for you.
There you go. If you could get that little wire rod that would go next to it, it makes it easier for him. If we, instead of going to the advanced area, we could just do an LMA at this point?
Yeah, I just don't have the spray stuff from this.
You know, and honestly, the most important thing you got to do, you got to have fun. Why do we work? Why do we do this? You got to have fun at where you're at. Attitude really is infectious. So if you don't enjoy your work, wow, that gets translated to the students. And really, how do you close that mannequin's mouth? I've never figured that out yet.
And lastly, ladies and gentlemen, we want to thank you for viewing our Tech Talk presentation today. This is our departmental mission. As you can see here, it supports our command mission, which is to provide quality health care, to deploy, and to train. So we thank you very much.
Thank you, guys. Appreciate your time. Know that I'm not a professional at this, at speaking on these slides. I can appreciate what our instructors have been going through. It is a bit frustrating. Mr. Parks and I are honored to work in this program, and we're happy to work with you guys.
And thank you very much.